I'd like to start off with saying that the second public health emergency, in response to COVID-19, I think blatantly brought to the forefront how our two public health emergencies were being dealt with so differently. The overdose death crisis that we've been experiencing since 2010 and earlier in Canada, but especially in BC and Vancouver, the rollout in relation to supports and changes in policy were much less than what we saw in relation to federal and provincial policy changes to address COVID-19. And so I think it brought our attention once again to the overdose crisis and what is determining this slow response. But I wanted to bring our attention to sort of the history that shaped drug control in Canada and why some ideas around drugs and the people who use drugs, colonization, are so deeply entrenched in Canadian policy. And I wanted to start off with a quote from James Baldwin, who's actually an American. He's a US writer and social critic who's passed away, but he wrote about race, class, and sexuality and what it was to be a Black man in the United States. And he wrote that the great force of history comes from the fact we carry it within us. Our history is literally present in all that we do, and in many ways, unconsciously. It wasn't until the 1800s that, until the 1800s, drugs and plants were available to Canadians and legal to all consumers. And people use these plants and drugs to manage their health, to reduce pain. And as today, people use plants for pleasure, cultural, and spiritual use. So early on in Canada, there was no distinction between medical or non-medical use of drugs or categories of legal or illegal drugs. It's argued that opium, alcohol, tobacco, these drugs were embedded in social customs in Western nations, and rarely were drugs like opium or heroin or morphine associated with criminal activities. But there were larger social and cultural changes taking place around the world. And one of them was the Protestant ethic, which was an adoption of sobriety and self-control as sort of the template of white Christian middle-class respectability. And with colonization of what is now known as Canada, came these ideas about sobriety and self-control. And these were brought to us by white settlers. Well, white supremacy, racial stereotyping of Indigenous and Black and Chinese Canadians, and defending the white nation against demonized foreigners were central themes of advocating for drug control in Canada. Originally, we just criminalized the smoking of opium and ignored the copious amounts of liquid opiums that white settlers consumed. Our focus was on criminalizing Chinese Canadians. But later, we added other drugs to our concerns, such as the non-medical use of cocaine, heroin, and other drugs. And in Canada, drug control from the 1900s on has been primarily a criminal justice approach. And we've seen more and more drugs added to the drug schedule and police budgets and police powers expanding over the years. So law-abiding people became criminalized overnight as we enacted harsher and harsher drug laws over the century. So our drug laws are not based on evidence of harm, rather there are social control mechanisms in large part to profile poor, Indigenous, and Black people in Canada. And I want to point out that drug offenses in Canada, early on in its inception and even today, that it's drug possession offenses that make up the majority of all our drug offenses each year. Meanwhile, while we criminalize drugs, we fail to set up any type of drug treatment or drug substitution programs in Canada. Rather, prison was a destination for poor and working class people and deportation of Chinese Canadians in the early 1900s. And when treatment was finally established, publicly funded treatment, it was abstinence-based treatment, which failed most people, regardless of the fact that a lot of people in Canada didn't have access to this. And it was established in the 1960s and 70s and on. So I'll just end with saying that throughout Canada's history, it's enacted some of the most punitive drug laws of any Western nation, with still life imprisonment as a maximum penalty for drug trafficking. And the drug dealer has been vilified in support of harsher sentences, with little recognition of the fact that the majority of arrests and convictions are for drug possession, and without recognizing that we haven't expanded harm reduction or safer supply programs in any meaningful way. But as we all know, and Am referred to this, there's been resistance, and right from the 1950s, but really gathering strength in the 1990s when we experienced our first overdose death crisis. And these resistance movements have had a huge impact and continue to do today, because it's those most affected and their allies who are demanding change, especially at this moment when we see overdose deaths rising since the COVID policies came into place. I'm going to leave it at there, but I just want to say that our ideas about people who use drugs, our ideas about addiction, about the addict, are very flawed, and that when we think about ending prohibition in its entirety, we have to think about how race, class, gender, and sexuality intersect with these punitive policies, and how drug policies shape child protection, child custody policies, drug treatment policies, and all of our ideas about people who consume drugs, whether they be legal or illegal. Thank you.